So what we're going to do, I'm going to bring the muscles back together and tighten the muscles and support tissues. By doing all this, we're going to enhance vaginal muscle tone, control, will effectively decrease the internal diameter.
I'm very excited that he's going to be able to make me feel like I'm 18 years old again.
All right, dear.
You.
Okay.
Woo! On Dr. 90210, surgeon David Matlock ventures into virgin territory with new procedures that put his patients' sex lives in the fast lane. And he is here today with us with one of his patients, Violet Estrada. Please welcome Dr. David Matlock. How are you? Okay. This is so interesting, and thank you for coming. Because, all right, you're the founder of the Laser Vaginal Rejuvenation Institute.
That's correct.
What is laser vaginal rejuvenation? What is that?
Laser vaginal rejuvenation, what this is a procedure basically for women who have had children, and they find that they have vaginal relaxation. They want to enhance things. So the purpose of laser vaginal rejuvenation is to enhance sexual gratification. And basically how we do it is that, if I can use the model.
You guys have Viagra, we have you. Is this what you're telling us?
Correct. That's correct. Correct.
Okay, this is
a pelvic model.
Okay.
A pelvic model, and basically for women to understand, if I can use the model, is that I'm going to take a laser and I'm going to open up the mucosa. The mucosa is the lining of the vagina.
Right.
So, and what I want to do is get to the muscles. Now, women who have had children, they can really understand this.
Right.
So, how should those muscles at the top, bottom, and outside be? Look at the right side of the body and left side of the body. The muscles should be nice, tight, supported.
Yeah, that doesn't happen after kids.
Yeah,
you go
but
looking
after
after you had kids, it's not the same.
After children, what happens? The muscles are separated. There's no support, top, bottom, or outside.
So what?
So what? That's a big deal.
So what?
Yeah, it's personal. It's
No, but
personal
in order
choice.
to everything from peace
But we'll
to
let him
sex.
explain what he does before we...
So I'm going to tighten the muscles. Tighten the muscles
tighten
in the upper
muscles.
part of the vagina, the lower part of the vagina, and outside. What we do, we want every patient to participate in our healthcare and surgical design. We'll ask the woman, how tight do you want to be? Women will say, I want to be 16 again, 18 again, or as if I never had children. Some women will say, I want to be 14. I said, ooh, you bad girl, you.
If they really want it, okay.
Let me ask you something.
Don't you think that this is a procedure that really makes men happy?
No.
Rather than the
Violet,
women?
let's ask Violet. Did you have this for yourself, or did you have it for your...
I had it for myself. To me, it didn't matter how the man felt. It's for me.
Okay, and that's why you found the doctor, right?
Exactly.
What was bothering you about it?
Well, after I had my kids, my first one was 10 pounds and my second one was 12. I didn't feel the same.
She had it vaginally.
And
Yeah,
did
I
you
had
try
that.
doing Kegels and try
Yes,
doing...
I did. That didn't help me.
Wasn't working for you?
No.
Because I mean, I know a lot of women do find them helpful. Doctor, you say they don't work, or
Maybe it works for you. Maybe that's good. Maybe that's excellent. But people are different, and I've treated
you
patients.
might not after a 12-pound baby. Who knows?
That's right.
How many women feel the need to get their vaginas rejuvenated?
Well, I've treated patients from all 50 states and over 30 countries, and patients are coming in throughout the world for these particular procedures. Actually, statistically, it's about 30 million American women who suffer from symptoms of vaginal relaxation, associated symptoms of stress incontinence. So it's a big, huge problem. I say, and what women have told me, Kegels don't work. And basically, we know they don't work. So women want alternatives. Our whole mission is to empower women with knowledge, choice, and alternatives.
Does this help? Because I know Kegels do a lot more than also increase sexual pleasure, right? They help support your pelvis, your spine, your overall well-being. So I think, to say that they don't work for all of those things is not what you're saying,
But he
right?
said something.
I just have a question. Do you also work with women from other countries who have had some of the really horrible procedures done to them to help get their women functions back going? Do you also work in that direction?
Yeah, what we do to a certain extent, but some of those patients, the problems are so bad that it's really hard to really do anything. It's very difficult.
Okay.
And I know
what about the G-spot? There was something about the G-spot.
Yeah, a lot of people. Well, no. First of all, what is?
I know you needed MapQuest to find it. and
Dr.
now I find out that you know where it is.
I want Dr. Matlock to tell.
He knows where it is.
That's what I'm saying. What is the G-spot and where is that baby?
All right,
I don't know why y'all don't know where it is. I know where mine is.
No, like you say, everyone just sat up in their seat Everything's ready to find
A
this
lot of
thing.
people don't know where the G-spot is.
Where it is.
You show me, what is the G-spot and where is it?
The G-spot is an erogenous zone in the top of the vagina that undergoes intense sexual arousal and sexual gratification. So what I did, a lot of things come to me very early in the morning or when I'm showering. So I said, hey, you know what? Why can't I educate the women on the G-spot, show them where it is, how to locate it, have them go into the room, do a self-examination, then I come in with the nurse, do an examination, verify it, and from the clinical investigational study that I've done, I've shown that 87% of women report enhanced sexual arousal, sexual gratification.
Let's see it.
So, here it is.
Notice how quiet it just got.
Okay, all right.
You have a captive audience
Okay,
right
so
now.
captive.
But I got 2 or 3 of them.
But just show us where the one is. Show us where the one is, Dr. Matlock. Come on.
Okay, Whoopi, I want to see that.
I know you do.
All right.
This
It's
show's
in the
getting
top
a little iffy now.
It's in the top of the vagina. Top of the vagina. This is the bladder. This is the urethra. All right. This is the uterus. It's in the top of the vagina. It's along the midline. The urethra, where you urinate, that's the midline. It's
Okay.
basically at the bladder neck.
That's
okay,
where the
that's it.
G-spot
That's
is.
How
what
do
it
you
is.
explain that to your husband?
You have him come see
Yes,
me.
yes, yes. Yes!
So it sounds to me.
That's good. But Dr. Matlock has created a G-spot. He's created a G-spot shot.
Correct.
No, wait a minute. It sounds to me that the way you put this G-spot where it is, it needs a very to find to get there. It's all the way at the top. Come on.
Well, I think where he's showing it is not that all. It's not all the way back
Did you
there.
say it was
no.
at the top?
It's halfway the distance
Right.
between the back of the pubic bone and the top
Your
of the cervix, the
finger can
anterior
reach
cervix.
your
You're
G-spot.
right.
Yes,
Absolutely.
Yeah, your finger can
Maybe
reach
this
your
pen.
Yeah.
I think I'll marry this pen.
No, absolutely.
But
But
the
you
G-spot
had-
shot.
The G-spot shot. What is that
Talk
that you
about the
created?
The G-shot or
Yeah.
G-spot
Did you-
amplification.
Did you have the shot?
Yes, I
Oh,
do.
you
What
did.
is the shot?
How did that
How
feel?
is it?
It feels awesome.
Well, tell them what the shot is, so we can know what the shot is and
What
what
the shot is basically it's a collagen base, and what I'm doing, I'm locating the G-spot.
Okay.
All right. I want the woman to really become in tune. The most important thing is for the woman to become in tune to the G-spot. So
Yes.
that's what we want.
Okay.
And then with that location, I'll numb it up and I'll inject it. It's a lunchtime procedure. The patient can come
You're in or
and-
you're out?
You're
Is it
in and out.
expensive?
It costs $1,850. Some patients may think that's a lot to pay for a
long does it
G-spot.
last?
We like to say it's a small price to pay for such a bundle of
Does it
joy.
have a warranty?
No, there's no
Did you
warranty.
like the G-spot?
Got it serious.
Yes, I did.
Okay, because you created it, Dr. Matlock, but you like that G-spot
Yes,
shot?
I did.
It's working
I loved
for
it.
you.
Really? It
worked
makes
for
you
me.
have an orgasm?
More than one.
And how long does it last? How long does it
Together,
last?
G-spot
It
fun.
lasts 4 months.
4 months. Well, you know what? We want to thank Violet Estrada and
That's
Dr.
4 months. That's
Matlock.
longer than most relationships.
Thank you so much, Violet and Dr. Matlock. We will be right back with the couple that went under the knife together. Multiple orgasms?